Hi there, Sierra Nevadans. Brian Evans here. Just wanted to give another update on how things are going at Sierra Nevada. We're doing very well. We have been taking care of COVID patients, but not a ton of them. And so that's really quite different from a lot of the other communities that are surrounding us. And I'm sure if you're watching the news, you're seeing that there's hospitals in Sacramento and in Placer and in San Joaquin that are really getting pretty filled with COVID patients and seeing quite a surge. Sierra Nevada has not seen a big surge at this point in time, so thank you for all you're doing to help really prevent the spread of COVID-19 in our community. We continue to really get ready and plan for whatever may come, and we're just working very diligently to make sure that we're prepared. I do want to address one thing. There's been questions about how do cases get attributed by the Department of Public Health in Nevada County. For example, if somebody gets tested in this community, but they're not from here, does that get counted on our numbers? Or if they're hospitalized, but they're from somewhere else, where do those numbers go? So I don't have all the answers to that, so I'm going to look into that with our partners over at the Public Health Department. But one thing is pretty clear. We haven't been transferring a lot of people out of this hospital to other counties. So that was one question that we had is are we transferring COVID-19 patients from Sierra Nevada elsewhere? And we haven't really been doing very much of that. So we'll get more answers for you for the next video. I also wanted to address hydroxychloroquine because that's really been in the news lately and it's been really politicized, and it's actually fascinating looking at this debate over a drug that is being tested essentially to see if it is helpful in the setting of COVID-19. And because things have evolved really quickly, there's been a number of different research studies on hydroxychloroquine. Most of them have not shown much of a benefit at any stage in COVID-19, but there has been some data that is like, there's maybe a little bit of an association here with benefit, and then people are concerned about the risks of hydroxychloroquine. Generally speaking, hydroxychloroquine doesn't have a huge amount of risk for people, but for some small percentage of people, it can be harmful. So I think a lot more study is needed, and unfortunately the political nature of this drug has really made it very unclear for the general public to understand whether it's helpful or whether it isn't. What I would encourage people to do is really go to the experts. And where do experts exist? Essentially, there are societies of physicians, there's the CDC, there's the Public Health Department, there's the NIH, and these are groups of experts that really look at all the data and understand what the research is showing, because it is fairly complicated to synthesize all of that information and give a clear recommendation. So I look at those sources and I make recommendations based upon that. At this point, we're not recommending people take hydroxychloroquine. I think more research is needed for it at this point. So that's about it for the update today. I'll certainly try to do an update roughly once a week. We're trying to schedule these on Wednesdays so that it's got a nice cadence to it. And please keep the questions coming. We'll continue to keep you updated about how things are going at your hospital. Thank you very much.